Ladies and gentlemen, based on the Knowledge, Attitudes and Practices survey on CPR and AED conducted in 2020, now over 50% of the respondents indicated that they would not start or are unsure if they should start CPR on a casualty who is not breathing normally or gasping. Now, did you know that gasping, also known as agonal breathing, is an early indicator of cardiac arrest? Now, considering that more than 3,300 out-of-hospital cardiac arrests happened in Singapore in 2019, it is therefore essential for us to be able to identify someone who is suffering from a cardiac arrest as quickly as possible, as the chance of survival decreases by 7 to 10% with every minute that passes by. So, how do we spot a gaps? Well, today we have our speakers, Professor Lim Swee Han, Chairman of the Singapore Resuscitation and First Aid Council, and Mr. Tommy Chu, CPR and AED instructor and community first responder, who will share more on how to spot a gaps, stop a death. But first, let's watch a short video with key information about cardiac arrest and agonal breathing. Let's watch.
Agonal breathing or gasping is an abnormal pattern of breathing that most often occurs when a person is in cardiac arrest. Agonal breathing is irregular, lasting from a few seconds to minutes. Gasping may be present in up to 40% of victims in the first minutes after cardiac arrest. It is important to remember that agonal breathing is not sufficient in delivering oxygen to the body. Gasping is a sign of cardiac arrest and is not considered breathing. Call emergency ambulance 995 if have not done so. Ensure adequate exposure to the chest and start chest compression over central of chest, lower half of sternum.
All right. Well, ladies and gentlemen, let's first get Tommy to share an incident where he responded to someone who is gasping. Now, Tommy, where were you and what happened during the incident?
It actually happened over in the morning, and I was actually in my clinic working. And then I was just really looking at my phone, and the next moment, the My Responder app actually sounded, and I was really excited in the sense that I can finally do some life saving. And the very interesting thing is that I have actually attended to quite a few cases by My Responder. But this time around, when I look at the address, it's actually amazing because it not only happened in the same block as I was in, it actually happened also at the same level as I was in. So I quickly brought along my warrant card, my glove, and then I rushed over to the unit. And upon actually entering the unit, I saw that there was actually a gentleman lying on the floor. And one of the colleagues, a gentleman, was actually doing a CPR on the victim. So I went over, and there was a phone on the floor, and there was actually so-called conversation from the medical dispatcher from SCDF to the colleague who's actually doing the CPR. So I took over, and immediately I did my assessment. And although I've actually attended to quite a number of cardiac arrest cases, but that case itself, when I was actually kneeling next to the casualty, I noticed something that's very different from the past cases. Past cases, the body was actually very still, there's no movement. But this time around, when I saw the casualty was literally mouth opening, closing, and tongue sticking out. And then there was actually hand movement. At that moment, I was thinking, gosh, this person is actually alive. But then suddenly I remembered that I must check for the breathing, all right, to see whether there's any rise and fall. So I immediately got myself together and then looked at the chest. And to my horror, there was actually no movement. And that was actually kind of like the first time that I saw a casualty was actually gasping. And I immediately actually have to start CPR. And while I was doing CPR, I actually then asked the two colleagues that was there whether do they know where's the AED machine. To my surprise, they did not know. So I directed them to actually the ground floor on the opposite block and get the AED machine. And then one of them actually went over and came back. And immediately he was just passing the AED machine to me. He says, nah, AED. I said, no, I have to do CPR. Can you help me with the AED? He says, I don't know. So I have to tell him step by step how to actually operate the AED, pass on to me. Then I stick onto the casualty and I continue my CPR until the AED prompts me what to do. And then the whole process that there was actually 2 shots I delivered and continue to do CPR in between the shots until the paramedic arrived, assess the situation, load the casualty to the stretcher trolley, and then bring the casualty down to the ambulance, and off they go to the nearest public hospital. So that was really an awesome first-time experience with cardiac arrest case with gasping.
Wow, thank you, Tommy. You're really a true lifesaver, and thank you for your responsiveness as well. Now, a question for Prof. Lim. Is it common for cardiac arrest casualty to have agonal breathing?
Yes, it is common for cardiac arrest victim to have agonal breathing or gasping, in the first few seconds of the cardiac arrest. Reports say maybe up to 30%. If you catch them early, then you can see gasping. And this group of patients actually has better outcome. So it's important to recognize it, like Tommy, and render help, the necessary help immediately, because any delay, the gasping will become will stop, and then there will be no breathing movement. You see, and then so it's more clear at that time, but then the outcome may be slightly not as good as when help was rendered during gasping.
Wow. Okay. So basically, you want to tell the audience or participants to when they're watching, if you see someone's gasping, don't wait. Yeah, we can help. We can help to administer CPR. Go ahead and do it. Now, question for Tommy. Now, Tommy, were you afraid that you might have deduced wrongly or injured the person that you were resuscitating?
Well, if I were to put myself in a position as a general public who has actually either learned or not learned CPR, I guess it's very natural that all of us would have that kind of fear. But for myself, being trained and being an instructor, I still do have certain worry. But then between being worried and doing it, I told myself that I've got no time and no chance to actually worry too much. Important thing is that time is against us, and I just have to really quickly do the CPR and recalling the steps and procedures that I've actually gone through the training and all that, and make sure that I apply them properly. Then that shouldn't be an issue. And of course, for those who are actually the general public, don't worry, because you must always remember that at the kind of time where you are concerned, make sure that you call 995 to the medical dispatcher, and then we will actually guide you over the phone on what to do, which actually minimize your concern and boost up your confidence in helping to save a life.
All right, I see. Okay, back to Prof. Lin. There are a couple of questions in this question. Now, first of all, what should we do if we are unsure whether a victim is gasping? And how important is it for us to be able to recognize the difference between gasping and having difficulty breathing? What's the difference?
As what Tommy has mentioned, the first thing when you approach victims is to check consciousness. Hello, are you okay? If the victim is unconscious and there is a gasping movement, and most likely, the victim will be in cardiac arrest. So should call 995, and then the SDF emergency dispatcher, now they are trained, to guide, the caller to recognize whether the patient has gasping or normal breathing, and if unsure, is always on the safe side. To start chest compression, and the benefits of starting chest compression on a cardiac arrest victim much outweighs, if it's chest compression was done on someone who is not in cardiac arrest.
Okay, so what are there any other signs of cardiac arrest that we can look out for? What are the what are the actions of the person who's having a cardiac arrest?
It is unconscious, unconscious, and there's no normal breathing. Our normal breathing is, when we watch the video, is the chest up and down every our normal breathing movement is once every 5 seconds. So if someone breathes long, sort of the breathing between each movement is more than 5 seconds, then you have to strongly suspect that it may be gasping.
So gasping is, for example, like you take a goldfish out of the bowl and you put it on the table, you see open its mouth very widely and closes. That's like basically gasping, yeah?
As you have shown in on a video.
There you go. Very, very scary to see such a situation.
Yeah.
Well, back to Tommy again. Tommy, yes, sir. Please do.
No, if I can add, probably it's like paying attention to the chest movement will be very important, because sometimes as a person who is panicking, as a bystander, there's a lot of things that's going in our mind that we do not know whether how can we remember the steps and procedure. But I think the key thing is really to observe the chest long enough, up to about 10 seconds, to make sure that there's no movement. Even if you see a slightest movement, like what Prof Lin said was really, really correct. If you think that there's a slight chance that that might be or might not be, then you rather err on the safe side and just proceed on with the CPR. It's actually better done than not doing anything to the victim itself.
True, true. They might appear to be gasping, opening them up, but actually they're not breathing. It's just a reaction of the body. Because
that case in 2018, I was actually really taken aback that I thought that maybe I should not do CPR. I mean, even being trained for so many years, is that when you come across the first time that somebody's gasping, you just got like, wow, this person, is it alive? Am I supposed to do CPR? Then you just get yourself together and says, no, I need to check the chest, not the mouth and the face and all that. It's also looking at the chest. Yeah.
Okay, that's a very good point. Now, probably easy for you to say because they think you're trained and you know the step to resuscitation. But how about those who are not trained in CPR? Can they still go in and resuscitate others?
Yeah, all right. So with regards to this resuscitation and using an AED, I guess that we need to put away the so-called misconception that you need to be trained. And also some people say that, what if my certificate is actually expired? Does it mean to say that I cannot do CPR and AED? No, life-saving is regardless of the certification. The certification is more of like making sure that you're more properly trained, you're actually taught more on effective and more efficient way of actually helping the casualty. And also the marvelous thing that the Singapore Civil Defence Force has actually came up with was actually the over-the-phone medical dispatcher assisted program, whereby you call 995. So like what Prof Lim said, it was really very important. In any point of time that if you think that something went wrong with somebody, don't panic, call 995, and then the medical dispatcher will guide you through what to do, including the assessments, including getting the ambulance on its way. The key thing is really to get help first, rather than to do it all by yourself, and then you delay the dispatching of the emergency medical ambulance, and then that will delay the chance of arrival and also delay the chance of survival. So even for people who are not, say, properly trained, or even people who are trained, they still have got no confidence of doing it, don't worry, call 995, medical dispatcher will guide you along the way, and just do it. If you ask me, in my own personal opinion, don't do it, the chance of survival is 0. When you do it, yes, you may do it wrongly, but the chance is still 50-50. So if you ask me, I'd rather go by the 50-50 where there's a good chance of survival of the casualty.
All right, thank you, Tommy. Now, also, there's one concern as well. Some people may be concerned that they may be performing CPR wrongly and also getting themselves in a lawsuit because of the gender difference, whether they should remove the clothing or, you know, male-female situation. This is also in relation with the Good Samaritan initiative by SHF. What's your take on that?
Okay, this is very, very good question, because most of the time, a lot of people, after they attend the training, they still do not have the confidence. One of the key questions that they always have is that, what if I do it and the person die? Now, two things you look at it. Number one, Singapore do not have a Good Samaritan law, but Singapore law is very much on intention. When you try to strangle somebody, your intention is clear that you're killing. You try to cover the nose and the mouth and try to choke the person, that is also a clear intention of killing. But if you are actually doing CPR, your hands is on the chest, doing compression of the casualty, everybody visibly can see that the clear intention is trying to save a life. So you do not have to worry about that. And anyway, if you look at it from another perspective, when the casualty is in cardiac arrest, technically speaking, or basically speaking, the person is already dead. How can you kill a dead person, right? So now coming back to the initiative that wonderful that SHF has actually came up with the so-called the legal services. They have actually this pro bono services that if you are concerned about this, you can actually go to Singapore Heart Foundation website under the programs, and then you can find this so-called Good Samaritan initiative. that they actually tie up with the legal service to provide pro bono advice in case you come across such a situation, as well as the chat box. You could actually see the website link, the URL is actually being posted. You can actually click on it. You can actually call the legal services for some pro bono advice on such an aspect where you actually render some help and actually somebody just passes on and probably somebody try to sue you. But in Singapore, it's very, very rare to have such an opportunity to be sued.
There you go. That's the answer for the question. For those of you who are worried about the sensitivity and whether you get into a lawsuit. Thank you so much, Tommy. And not to worry, it's in the chat as well. You can always link, click on the link to find out more. Now, ladies and gentlemen, hold on, guys. We have more questions coming in, but right now we're going to open the session to members of the public. It's time right now for the Q&A segment, and of course, if you have any questions, you may type them in the comment section, and we will do our best to answer them. Okay, so go ahead, guys. The chat box is open. In the meantime, feel free to drop some questions. But in the meantime, I've got some questions for you. Prof. Lim, now, is cardiac arrest the same as heart attack?
Cardiac arrest is slightly different from a heart attack. Cardiac arrest means the heart is stopped pumping. However, most of the cause of cardiac arrest is because of heart attack. But less than 5% of heart attack will cause a cardiac arrest. So this is a slightly difference. And heart attacks is because the blockage, we have 2 coronary arteries that supply the blood to the heart muscle. So if the arteries are one of them or 2 are blocked, then the patient will have a heart attack. And when the patient suffer heart attack, they will have symptoms like chest discomfort, breathlessness, and if the patient did not seek medical help sooner, some of them may develop cardiac arrest. Suddenly the heart, the rhythm becomes irregular. This is called ventricular fibrillation. As a result of heart attack, and then cardiac arrest will the patient will go into cardiac arrest. And when the patient went into cardiac arrest, the heart is not pumping, and they will experience you will unconscious, and then unresponsive, and no normal breathing, gasping.
I see. So that answers the question. Now, coming from Sin Yi Ng, how many times do we need to do CPR and AED until the ambulance come? How much compression maybe, or how long the duration? Anyone can answer this question?
The time, although SDF, I think the response time is quite good, internationally, but because of the densely populated nature of Singapore, the median time for the ambulance to arrive is around 10 minutes, right? So expected to do chest compression for around that time, for about 10 minutes. So if you're tired, of course, if you have someone around and you can summon the help of another sort of bystander to alternate chest compression. Normally, about when we do continuous chest compression for 2 minutes, we get tired, and so then we alternate. But if you are alone, then try to hang it on as long as you can, and you can take a 10-second break for every 100 chest compressions. That's our recommendation.
Yeah.
Okay. Next question.
If I can add about the compressions for Xingyi, how many times basically, if you are really the one doing the CPR and you are not familiar where is the nearest AED or there's no bystander, please continue to do the CPR for as long as you can until the emergency medical services personnel arrive. All right, but if let's say you really know that the AED is just outside the door, then you could actually perform at least 1 minute of CPR before you can actually go and retrieve the AED. But if you really are not familiar, please don't go out and then hunt for the AED, because the CPR is far, far more important as the fundamentals of resuscitation. The AED, of course, is a key important element to help the casualty regain the compression, but the massaging of the heart through the chest compression will actually help to pump the blood to the brain and keep the brain alive, which is really vital for the survival of the casualty. So that's the reason why, like what Prof mentioned, average, sometimes we need to 10 minutes, but maybe I've not shared with Prof before. The 2 cases I've actually done, I was all alone, and I have actually do continuous 30 minutes of CPR, and nothing to do with the ambulance being late or so, but it is just that it was actually early in the morning, and most of the ambulances were likely engaged somewhere, and the nearest ambulance from SCDF have to come from a further location. As such, I have to continue the CPR for as long as 30 minutes. So ladies and gentlemen out there, later part, when the second part of this segment where we have the training, we'll be encouraging you to download the My Responder app. Please download, because that is where more people actually can be summoned by the My Responder app. And can you imagine that I was actually tired, and if somebody else has came over, we can actually rotate CPR, and then we can maintain the good quality of CPR for the casualty to increase the chance of survival.
All right. Okay, next question for probably Tommy. This is very important, very sensitive question, coming from Purvi Gupta and Gavin Wong. Now, is CPR administered differently from female and male? Are they the same or different?
Well, fundamentally, the anatomy of a body is about the same, except that for our female casualty, well, they have the breast, and as such, some so-called rescuer or responder may feel that they are worried about actually outraging or modesty of the casualty during the chest compression. But then again, let me just remind all of us, be it whether it is a female or male casualty, be it whether it's a male or female first aider, well, just remember that your intention is to save life. So you do not have to worry too much, because clearly that if you do a proper CPR, you have got very minimal contact with the so-called the sensitive area of a female. And that is really the last thing you should be concerned about. And let me also take this moment to share this thing that I've got this, I hope you all can see that there is this mannequin that actually was designed by the, I would say, Singapore Heart Foundation. They came up with this. Oh no, is it here? Yeah. Okay, so this is actually a mannequin whereby they have a vest where they have the breast. And then this is actually now distributed across to all the different training center. And so that when you actually go and learn, you can also ask for this type of mannequin so that you can actually practice CPR on the casualty as if it's a female, and then you can have a sense of, like, whether, are you going to be actually having too much of physical contact with the sensitive area. So that is so wonderful. They came out with such a training aid to actually help us in better learning.
Well, I remember that as well, folks. You guys can actually take a look at the past videos in our SHF Facebook page, where we have the female mannequin, and we did some adjustments to the undergarment, where you should place your hand and all that. So for more information, you can watch the video, all right, on YouTube and also our Facebook page, SHF Facebook page. Thank you, Tommy, for that. Now, next question is a combined question for both Prof. Lim and Tommy as well. See which one of you can answer this. Now, this is from Winnie. I think Winnie will probably be an AED facilitator, or what do you call it, a good Samaritan. Now, thanks for the informative presentation earlier. Now, in the current COVID situation, is there anything the first responder need to take note of? And this is also coming from Me King as well. Now that mask is wearing, or what mask wearing is mandated, right? Is it okay for us to remove the mask of the casualty to facilitate CPR? Sensitive questions, right? Prof. Lim?
Yeah, can you repeat the first question again?
I mean, like, now the casualty is wearing the mask and all that because of COVID. They are afraid of COVID transmission and what, so not maybe hygiene purposes, but is it necessary, or is it the mask for us to remove the mask and continue on and not being fearful of COVID or other transmission?
The recommendation is that leave the mask in situ. That means do not remove the mask. Just continue to do chest compression.
Okay, so like 30 compression. And what about breathing in air into the mouth? Is it necessary, or just compression alone?
The optimal, this again is another question that always brought up. I think for the especially for children, you know, and mouth-to-mouth ventilation. Ventilation is important, but you are out of the hospital or out of healthcare facilities. The only thing you can do is mouth-to-mouth, you know, to provide the ventilation. But first thing is a very difficult techniques to learn. Secondly, is even before the COVID, you know, people do not want to do mouth-to-mouth because of hygiene reason, you know, so we will encourage the public just do a chest compression just do chest compression, and the outcome, you know, for adult is as good as you know, doing chest compression as well as mouth-to-mouth ventilation. And because if you do not do a good mouth-to-mouth ventilation, you know, it may not be effective. So I think it's best to just concentrate on chest compression.
Yeah, I guess in a practical sense itself, like when I'm actually responding to cases, if you ask me that if a bystander who are not frequently trained or so, then if you ask them to actually do mouth-to-mouth ventilation, like what Prof mentioned, they may either do it wrongly or they may spend so much time trying to figure out how to do a good mouth-to-mouth ventilation, and that delay the start of the chest compression, which is actually more important than the mouth-to-mouth ventilation. We're not saying that mouth-to-mouth ventilation is no good, but we're just saying that what is really more vital for the survival and the well-being of the casualty, which is actually the chest compressions, ought to be started as soon as possible. So I guess when we conduct training, we always share with the public, if you want to do it, best, but then the thing is, it is an optional element. Don't pay too much attention to that, because starting the chest compression is more critical for the survivor as well as the brain for the casualty. So that's why starting CPR compression is more important. And on the mask wise, I don't know what Prof mentioned. I totally agree that we leave it on. But sometimes during the practical aspect, if we are already catching our breath, I think it's up to individual. If you ask me, I probably will have to remove it and then do the CPR, because I also want to be able to catch a breath while actually saving the life. If not, end up I am the one also needing CPR too.
I see. Okay, question from Sarah Chia. Now, what if the victim is a child? Because, you know, you might need to use one or two hands because the child is very delicate and small, you know, small rib cage and whatever not. So do we use both hands or one hand? Less force. What do you guys reckon?
Well, it depends on the age of the child. You know, if it's more than 1 year old, then you can either use two hands or one hand. And the important is the depth of the chest compression. You know, which is 1 cm, sort of less than the adult. So it's sort of about 4 cm. You know, and I think that's important. So it depends. I mean, if you are very strong and you think that if you use two hands, you will exceed the depth, then I think one hand is acceptable.
And of course, to add on, I think during that kind of situation, ladies and gentlemen out there, don't go and remember all these things, because we might not remember. The most important thing you ought to remember is 3 numbers. 995, because that's where you call 995 and get the medical dispatcher to guide you, so that you don't have to worry whether can you remember. But of course, you can remember, as even better. But if you cannot, at least 995 is the key number to call. Please don't go and call your relative, your friends and all that to ask all these things. Call 995, because we also need to dispatch the ambulance as soon as possible.
Okay, so we have our final question, because we have so much question, but we're going to take one final one because we have the training coming up and it's so exciting, and I can't wait to see you guys doing it. Now, last question from Mi King. Now, during initial checking of the casualty, don't you need to check for choking if casualty is gasping? Maybe there's something in the airway, or should the first aider still check the airway before doing CPR in gasping situation? What do you think?
Usually choking, cardiac arrest is due to heart attack is more common than choking, you know, and choking usually is a weakness event. That means someone is eating, you know, swallowing a fish ball or you know, a rambutan or durian, you know, so usually is that sort of circumstances. If you see someone suddenly go unconscious and is not eating, and most likely it will be cardiac arrest. You know, and the treatment for choking, when the victim is like, when the victim is sort of conscious, and then we can do the abdominal thrust. And when they go into unconsciousness, in fact, we won't know whether is it cardiac arrest or is it choking. So the treatment is the same, it's chest core 995 and then chest compression.
Okay.
Because as we do the chest
Thank
compression, we
you.
actually also compressing on the chest,
Yes.
and then it will actually kind of use the remaining air in the lung to actually dislodge the foreign object. So that's why the important thing is still always come back to the chest compression.
I see. Okay, that answers the question. Now, thank you all for the questions. I hope you guys have gained a tip or two about the spot a gaps and stop a death. Now, also, ladies and gentlemen, before we go into our training, Prof. Lim and Tommy Chu, is there anything else you would like to add on apart from all the answers? Anything to add on?
I think one of the questions they asked about chest compression only CPR. In fact, we now recommend public, the non-healthcare provider, just to concentrate on chest compression. So chest compression only CPR and the AED training are the norm, for most people, and this is because you should focus on what you learn, other than you learn too many things and then you're not good at what you are doing, So now the recommendation is that to concentrate on chest compression only CPR and hands only CPR and AED.
Yeah, on my part, I would like to add is that you see, Singapore Heart Foundation has actually came out with this very wonderful Restart a Heart program. And then basically Singapore Heart Foundation, SHF in short, is actually reaching out to as many people out there, be whether companies, commercials, factories, any organizations, that if you would like to actually have this training done, contact Singapore Heart Foundation. There's no charges to it. I mean, if you like to do donation, that's even better. But if not, at least you could actually arrange this now, especially it's actually virtual. Today, we actually launched the virtual Restart a Heart program. It can be brought to your organization to better prepare your staff and everyone to be more well aware about the fundamentals of CPR and AED, so that we can have more lifesavers on the street. And next moment, if there's anybody that's in distress, at least we have got more lifesaver around, and the chance of survival will be even much better. So do contact Singapore Heart Foundation for this, to actually raise more awareness that we can get more lifesavers on the street. And very important thing is that don't hesitate, just save a life, because that moment that you do it, it is really very awesome, because you can actually help the person stay around for as long as you want to, right?
Now, there's a very good tip there, Tommy. Now, everyone, don't worry if your questions are not answered right here live in this session, but not to worry. We'll reach out to you separately to answer your questions accordingly. Now, lastly, we'd like to thank our kind sponsors, Philips Foundation, Captain Oats, as well as Good Salt, for making this event a success. Thank you so much. Now, please stay with us, as our instructors will now be putting you into the breakout rooms. Enjoy.